officer with the Komarok Modern. Here we practice a range of all the oral health issues that clients present with. Most of the time, the most common cases we meet here are the most common cases in Kenya: dental caries, bad breath.
Yes.
And here in Utawala, because of water with too much fluoride, we see clients with a bit of fluorosis.
Fluorosis.
Yeah, the brown teeth. That's what we encounter most here in Utawala. Yeah.
Okay.
Yeah.
Yeah. So before we go to talk about the common problems that you handle, will you just take some time and tell us the kind of services that as
We
a
have.
dental officer take care of? Because there are people there asking, I have this issue, who can I see? So just tell us what kind of services you offer as a dental officer.
Okay. Actually, in dental, we talk about oral health. When we talk about oral health, we talk about the teeth, the gums, the tongue, the jaw, and even the lips. All of it form the oral structure. Now, when a patient has an issue with dental, the first thing the patient has to do is to come to the clinic. Then we do the checkup.
Yes.
Once you do the checkup, you start by assessing the mouth. You ask the patient to open the mouth. You examine the mouth. You examine the teeth, starting from the lips. But generally, you normally even start from the face because you could see another problem before you go to the mouth.
Yeah.
Then you see the teeth. The first thing you normally spot when the clients open the mouth, you see is if they have dental caries, if they are tartar, or we call plague. Yeah, they are normally very common.
Yeah.
And some people don't even know what they are. So you see when there's a patient presenting maybe with a toothache, it varies. There's a toothache that patient comes with even holding the jaw. Some come complaining even of the pain radiating to the head or the face. So you handle the patient depending on the presenting complaint.
Yes.
Yeah. The patient will come and tell you, now, I haven't slept for a week. Another one will tell you, I just feel sensitivity. Another one will tell you, I just want checkup.
Yes. Okay.
Yeah.
Oh, that's quite a range of services.
Yeah.
Now, so let's talk about a few of the specific common problems that you've mentioned. Let's start with the bad breath. What is a bad breath?
A bad breath, we normally call it also odor or bad breath, or halitosis in medicine. That is caused by a couple of things, but mostly the primary cause of bad breath is the food particles that pile. We call them tartar or plague.
Yeah.
It piles inside your teeth, alongside the gum, and it piles over the ears or over the mouth. By the time you realize, it's now a film or something that cannot be, even if you brush, it cannot come off.
Okay.
Then now it starts to irritate the gum. When the gum is irritated, when you brush, you start to see blood coming out. So it presents also with bleeding gum. And also when you talk, some people will tell you your mouth is having a smell. Some will not tell you, they'll just avoid you. So it is actually something bad, because some people will just avoid you, will not tell you. But also you can feel it for yourself. Yeah, you can feel like, no, my mouth is not fresh.
Something's not right.
Yeah. So when such a case presents, now you need to visit our clinic. And then when you reach, we can now examine you. Then we perform what we call full mouth scaling.
Okay.
Full mouth scaling means you clean using a scaler. You clean all the plague. And then now you do polishing.
Yes.
Polishing, you polish to now bring back the fresh breath that was lost. Because once the tartar is in the mouth, it introduces an environment of now something like, it has its own environment whereby it has different smell depending on the people. Yeah. And also once you clean, the gums now will heal. There will be no bleeding gums. Yeah.
All right. Now, what are some of the common practices that we do daily that eventually lead to development of bad breath?
Inefficient brushing. Someone will tell you I brush all the time, but no. You just go to the sink, you brush for like 30 seconds, you are done. You have not removed anything.
Okay.
Also the technique. While brushing, the technique of brushing is very important. Like you need, people while brushing, they just do back and forth. We normally recommend that you do small circles, like you brush and also be gentle.
Yeah.
And use a soft brush. Yeah, because there's also something that creates, when people brush using a lot of force, the gum will recede, like the gum will go down from the level it used to be.
Okay.
And now you'll have to develop another sensitivity from now brushing. Yeah, so brushing should not just be brushing, but brushing efficiently and also the right method.
Yes.
Yeah.
All right.
Yeah.
Does biscuits cause bad breath?
No, but it can cause dental caries.
Okay.
Yeah.
We're going to that. Now, let me ask another question. Does using Listerine at home help?
Yeah, it
bad
helps
breath?
a lot. Yeah,
It does help.
Yeah.
All right.
Yeah.
That's good to know. Let's talk about dental caries. What is this about?
Normally, dental caries is just a black spot. That's how it manifests.
Yeah.
But it is a decay. You know, the enamel is always white. But when you see a black spot, now that's a caries beginning.
Yeah.
Caries basically means a decay. A decay on the tooth. Yeah.
Okay.
So it starts on the surface, other starts at the, we call it cervical, along the gum.
Yeah.
Yeah. Another starts in between the teeth. Yeah. We call that proximal decay. Now, that one manifests with time. Dental caries doesn't start today, and it takes time.
Okay.
But normally, there are caries that will go deeper. They are the ones which will just remain in the enamel.
Yeah.
But depending on the time. Yeah.
All right.
Yeah.
So you can have a mild form and a serious form.
Yeah, you can have a client complaining of sensitivity, another one complaining of serious pain. Now, if I may use a diagram of a tooth,
Yeah.
you may allow me.
Sure.
Now, this is an enamel.
We can show.
Okay.
Yeah.
This is an enamel.
Yes.
Now, you can remember the parts of a tooth. This is an enamel, this is a dentine, this is a pulp chamber. Now, this is the root.
Wait. So which one is outside in the mouth?
This one.
This is in the mouth, and this part is
this one is the root. Now it is inside the jaw.
The jaw.
You cannot see it.
Yeah.
These are the gums.
Right.
Yeah. So you remember when I was explaining earlier about brushing roughly,
Yes.
using excessive force. Now what happens is you irritate the gum here, you push the gum down,
Yes.
and then
When
now
you brush forcefully.
now the gum recedes, it goes lower.
Yeah.
You leave this part. This part is sensitive because it's supposed to be covered by the gum.
Yes.
Yeah.
I see.
Now we have, I was explaining, we have one which shows the decay. Now this is the decay now.
Yes.
The decay starts from top, like I explained, commonly, but there are some which can start from here, depending. So it can come from here. There is a decay which will just stop here at the dentine. So when the decay comes up to the dentine, that one you can just do a filling, because the decay does not go as far as where the nerve is.
Yeah.
But if it breaks until here now, where there is pulp chamber,
This is where the nerve is.
yeah, this is where the nerve is, the blood vessels, everything is here.
Yeah.
This is what keeps the tooth alive. So now if the decay reaches here, now you have to remove the nerve.
Okay.
Now those are two different procedures now. If you are doing a filling, it's a decay that has come as far as the dentine. Now this one will require a root canal, whereby you remove the whole nerve and the whole pulp.
Okay.
Yeah, everything there.
Okay.
It's a procedure that you do 3 appointments, once a week.
So it's staged.
It's staged because you have to clean it, remove the nerve, give it time to heal, come clean it again.
Yeah.
Yeah. Then there is this part where you are seeing here. This is what we
Down
call.
here.
This is now what
This
we
is
call.
deep in the bone.
Now at the apex of the root.
Yes.
This is what we call periapical abscess. Now the decay has gone far beyond the nerve, down to the root, up to the apex.
All right.
In such cases, now this is when we advise for extraction.
Tooth extraction.
If the crown is not sound, sound meaning it's not that strong, you can consider removing the whole tooth.
All right.
Yeah.
Okay. Sounds good. A question. How serious is dental caries? Can somebody die from dental caries?
Well, it depends on the underlying cause. To say you can die from dental caries is not really, but it depends.
Yeah.
Because I think I should explain this. Some clients will say, I had someone who was done tooth extraction and then they died of cancer. That's what I've heard.
They died of cancer.
Yeah. Okay. So it's not related to the tooth. Okay. What happens is the patient had the cancer.
All right.
Then now this is something that just was there. When you remove a tooth now, it's like now you're just triggering something which was there. Now there are some dental infections that are dangerous. Like if a patient has an infection, we normally say a dangerous triangle. Here, if you can follow, the teeth, let's say from canine to canine, because there is a nose here, so there is an opening there.
All right.
So the infection can travel from the tooth to the nose, to the ear,
up
to the ear.
Yes.
Yeah. If it can travel to the ear, then it can travel to the head. That is where now it can complicate everything.
So that's now in advanced cases.
It can something that is advanced.
Yeah.
So when you ask me that can kill a person, I can say but that's a very advanced thing. By the time it reaches there, it shows a lot of negligence for a very long time. Yeah.
You've been sick, you've been assuming.
Yeah, you've been assuming. Yeah. Because by the time you're having a swelling as big as this and you're not going to the dentist now, that is something else.
All right.
Yeah.
Wow, that's quite informative. Let's talk about the gums. What is the problem that we are all having with the gums and we don't know?
The problem we have with the gums comes from the tartar, the one I explained before, and also the brushing. Now, the gums are always healthy, but they need to be taken care of. Taking care of meaning brushing well, using of mouthwash, also warm salty water.
Warm salty water.
Yeah, it does really help.
Wow. Okay.
Then we talk about this tartar. Like I explained earlier, they irritate the gum. When they irritate the gum, they need to be cleaned. And we normally advise after every 6 months you do scaling, just to make sure that the gums are healthy.
Okay.
Yeah. Because if left, those things can actually make a tooth weak. It can actually come on. If you've seen these people with long teeth or teeth in kama imecheza, they look like they are mobile and they are adults.
Loose.
Yeah. It's because of the tartar. It makes, that the gums are the one holding the tooth. Now, if they are loose, it means the tooth is left alone.
Okay.
Yeah.
I see. Thank you very much. I think we are going to take a break from here and we'll be back.
Thank you.
Yes.
You are watching TV47, the home of untold stories. Tonight, 9 in 10 esophageal cancer patients succumb to the disease.
We are soon going to launch 90,000 community health workers. That program, if it goes to those community health workers, it will be of much value in driving this cancer menace out of this country.
High cost of treatment attributed to the high mortality rates. Also tonight, Nakuru couple lose quintuplets hours after their birth. Doctors say they were underweight.
It's unfortunate tumepokea hizo ripoti and sio za kufurahisha, but hatuna kitu cha kusema kuze. Tutasema tu God ni alitupea na ni amechukua.
Plus, TRC interdicts 5 teachers over claims of forcing pupils to simulate sex in Kisii County.
Kaluma King Herbal Lozenges zinazo nguvu maradufu kutuliza kikohozi, vidonda vya koo na mafua. Kaluma King ni shwari.
Chika mama huyo muharifu kaiba kuku zangu, vifaranga wangu na mayai zote pia kabeba. Aya, chika mama huyo.
Maumivu yakizidi, muone daktari.
Authentic, natural, planned. Transforming. Endless benefits. Slaty, purely Kenyan. Buy now on Jumia or Amazon.
Sona Moja imetengenezwa kwa njia spesheli ili kupambana na maumivu kwa haraka. Sona Moja ina aspirin kama kiungo. Sona Moja, kitulizo kamili. Maumivu yakizidi, pata ushauri wa daktari.
You are watching TV47, the home of untold stories.
All right, welcome back again. We are continuing the conversation about oral health. And Dr. Cosmas is continuing to educate us here about the best practices that we can employ to take care of our oral health. Daktari, thank you so far. So we were talking about the gums, and you told us about practices like brushing that can help us maintain healthy gums, but at the same time they can destroy the gums, right? Let's continue, let's pick from there. Now, there is somebody who will say that their gums were good, but they're saying like it's reducing in size, and their teeth looks longer than they were before.
Yeah, we call it recession or receding.
Yeah.
Sometimes you may see that the gums are going down. It's the same thing that I was explaining. When your gums are going down, it could be because of two things. Excessive brushing, whereby you are using a lot of force.
Yeah.
Now you are even, when you look at the tooth, towards the gum, there is like a cut.
Yeah.
Because now there is a separation between the gum and the tooth.
Yeah.
Yeah. So when the gum goes down, now you'll have to start to feel sensitivity.
Yeah.
Because now that part is not supposed to be exposed. It's supposed to be closed.
Yeah.
Yeah, that's one thing. Another thing is now the tata I was explaining. We normally say that gingivitis, I think you've seen that, inflammation of the gum. So when the gum is inflamed, it swells.
It swells, yeah.
When it swells and nobody takes care of it, like now it's not cleaned,
Yeah.
now it will go down, or it will separate from the tooth now, and then it recedes slowly. It doesn't happen overnight. It takes time. Like now, if you've not cleaned your teeth since, let's say you are 25 years, and you've never cleaned your teeth since when you were young, and you started having maybe this tartar at the age of maybe 15 or 16,
Yeah.
that thing will have really built up to the point that now it's no longer a film, but now a plague that is piling on the tooth.
All right.
Yeah.
That's quite important. Let's talk about something that you already mentioned, sensitivity. There are some of us who, when we just even drink water, we feel a lot of sensation that is really uncomfortable. We can't eat some types of food that is hard, or even when we just see something, our sensation is already triggered.
Yeah.
What is happening?
Well, sensitivity starts from gum recession to also dental caries. Dental caries can bring sensitivity.
Yeah.
Also, there are these people whereby they cannot drink or eat anything cold. Now, the sensitivity could become, and when you look at their teeth, they are just nice, but you cannot see any decay.
Oh, yeah.
There you could say there are some proximal decay. Proximal decay means in between your teeth. You cannot see them. So when you take anything cold, that's when you start holding your jaw like this, something. Also, it could come from the recession of the gum. Now, from the recession, normally we say now the gum has receded. You can first relieve the sensitivity by using Sensodyne. And they have a lot of products. But if there is coming from a decay, you cannot do Sensodyne. You need to do a filling.
So if somebody has sensitivity, you don't treat it at home. Come first.
No, come to the clinic because you need to know what is causing sensitivity. Yeah.
All right, that sounds good.
Yeah.
Any particular things that you have not mentioned that might be propagating sensitivity?
What I've not mentioned, I think I've mentioned almost everything. Most of them.
Let's talk about something else. There are people who are born with just white teeth, natural white teeth. But over time the color changes, maybe yellow, maybe black, and also the teeth start to appear shorter and ragged.
I hear you. Now, there are, what will I use the term? Habits.
Okay.
Whereby, let's say, now you are in primary, you're good. You're in high school, you start developing such things. Now, there are habits that bring about such things. Whereby one of them is smoking. Another one is chewing. Chewing of this mirror and everything. Now, it stains the teeth. It stains the teeth. And smoking, the tar in the smoke. It actually sticks in the teeth, the enamel part. Now you'll start seeing those black stains, pole, ikikuwa like it's like a spot. Then it becomes now a whole film. The whole part, especially the inner side, you see it's really black. Then now the enamel starts to break, like it starts to break pole. So those are the habits that makes the tooth shorter. But there's also another habit that is not very common in many people. There are people when they are sleeping at night, they grind their teeth. When you grind for over the years, your teeth will start looking shorter because you are grinding. But it is not common with everyone.
Wow. Does milk cause teeth staining?
Milk,
because some people ask, I think it's milk, I think it's tea.
No. Milk doesn't.
It doesn't?
Yeah.
All right. That's good to know. So let's talk about what some of the practices that we can employ to make our teeth stronger.
The first one is actually regularly visiting a dentist. We normally recommend after every 6 months.
6 months?
Yeah, you go see a dentist for checkup, even if you don't have an issue, which I know is not here in Kenya actually. Very few do that. Another thing now is efficient brushing, not just brushing. You need to brush well, the right way, use the right brush, and brush it gently. Don't fight with your mouth, like be gentle.
Okay.
Yeah, then avoid these habits like when you're in a party, you open a soda with your teeth, you will break it because there's a metal versus a bone. You will break it. Yeah, and then another thing, chewing of this stuff like the mirror.
So we should avoid the
because when you take those things, itabaki kwa meno. Yeah, definitely.
Does chewing gum help our teeth or it worsens it?
Well, it helps not only the teeth but the jaw also because of exercising. But now, which chewing gum are you using? Because you will use the chewing gum which has a lot of sugar, you will risk getting dental caries as well. So there is this sugar-free chewing gum. You can use it, but don't make it habit. There is what we call the quantity and the frequency. Now, this is for all the sugary stuff, from sweets to biscuits to cakes to everything that is sugary. When I say quantity, how much do you consume? Like now, while you're walking, how much do you consume? That's the quantity. Now, frequency, after how long? Now, sometimes frequency is worse than quantity.
Yeah.
Like now, if I can take 10 sweets today, or like 2 cakes or pancake, queen cakes like 2, 3 or 5 in a day, and then I do it again after 5 days.
Yeah.
Versus someone who does that like queen cake asubuhi, cake lunchtime, sweet jioni, you see?
Yeah.
That frequency is too much. Yeah.
All right.
Yeah.
For people in the village, does chewing the sugar cane? Chewing sugar can make our teeth stronger. There's a myth that you need
also
to chew
the
sugar.
jaw, it helps.
Sugar cane.
It helps. Though I cannot say it's something that is proven,
Yeah.
but you know it helps. It helps because now when you give a boy who is 10 years to start chewing, and you know, you make the jaw stronger, you make the teeth stronger. It's just like normal exercise. Though it's not proven, but I know it helps a lot.
Okay. All right.
Yeah.
Wow. That sounds interesting. Last bit we want to talk about. Let's just help the children have better oral health. We've talked about things about adults, but what about the children?
Children is about the lifestyle. Yeah. The children can be taught from young age what is dental health, what is oral health,
Yeah.
how to take care of their teeth, what not to consume, because they are the one who consume all this sugary stuff.
Yeah.
Yeah. But they are the, if you want to have something nice, start from them, because they will carry it along as they grow up.
Yes.
Yeah.
All right.
Also taking them to dentist for, you know, like now if you have a child who is scared of a dentist, just take the child to the clinic to familiarize with the place. Like you can take the child sits on the dental chair, sees the instrument.
Even when I'm not having any procedure.
It's just like to familiarize with the whole place. So that, you know, there's this phobia that dentists are always the people who make you feel a lot of pain.
Yeah, yeah.
But if you change that narrative by teaching them, just taking them, let them see the instrument, let them see the room, the chair, and then just go home.
So the next time when you tell them we're going,
Yeah, they're okay.
they'll be happy to come.
Yeah, because now they know it's not that scary as they are used to. You know, back home they scare each other. In school, I was removed a tooth and it was very painful.
Yeah, yeah. Wow.
Yeah.
That sounds good.
So it is a way of training children to accept dental treatment and also to change their perception about the dental treatment.
Yeah.
Yeah.
That's great. So if a child who still has the first teeth, the milk teeth,
The
name is
primary,
called
yeah.
the primary teeth, and they have discoloration of that teeth, should they come to the dentist or they should wait because it will fall off?
No, they should come.
Okay.
There's something I should explain. When a tooth, let's say a child has 3 or 4 years, and maybe a baby molar has a decay.
Yeah.
You cannot say, let me stay at home, because that tooth will eventually come out. It needs to be filled.
Yes.
The reason to fill that tooth is because a baby molar will come out at the age of 10. You see? So if a child is 4 years and you remove that tooth at the age of 4, by the time that permanent tooth will come out, the space will not be there. So you are trying to prevent the issue of malalignment, whereby there is no space. Now the teeth have to overcrowd.
Yeah.
We call it malalignment. Yeah. So normally every tooth has a time for it to come out. So you should watch out. Remove it at specific time, and also when there is a decay, try to fill it.
Yeah. All right.
Unless it has a decay and it is mobile, that's when you remove it.
All right.
Yeah.
Let's talk about some things that parents can benefit in taking care of their children's oral health. So 1 year old, 2 years old, how are they supposed to brush their teeth or take care of their oral health? Some parents will report difficulties.
You know, at that point they are very uncooperative. They don't want.
Yeah.
They are still young. But every child wants to do than adults does. Okay. So while you're brushing yours, there's this baby brush. You can buy them their brush. Also their toothpastes, because their toothpaste has a very low content of fluoride. It's okay even if they swallow; it doesn't really hurt them.
Yeah.
So you can teach them how to brush pole pole. Give them the brush, they play with it. But also you need to brush it for them to know how it's supposed to be brushed.
Yeah.
For now, because now if you have the child, he will not know how to brush. You just think you just put the brush and then throw it.
Okay.
So you have to just be there with them, teach them how to brush pole.
Okay.
Yeah.
That's great. The last bit. Someone asked that at 11 months they have not seen any teeth coming up, while another one at 3 months they're already seeing some teeth.
Yeah, that thing happens a lot, and it has all the moms panicking around.
Yeah.
The children are not the same, especially for the boys. They are very slow.
Boys.
You can have a boy at the age of 7. He has not even started removing his teeth.
Yeah.
You can have a girl at the age of 4 started removing the teeth. You can have a girl at the 6 months akona meno mbili, and a boy maybe and also it's not necessarily a boy. They are children who are naturally slow. So the best thing is that just wait. They are going to come no matter how long it takes.
Yeah. All right.
Yeah.
They ask if somebody has delayed
delayed eruption.
Delayed eruption. Is there something they can do or something they can give for them to come out faster?
Nothing. Just wait. Be patient.
All right. Thank you very much, Daktari.
Yeah.
This has been a very informative session.
Okay.
So we are going to take a break, and when we come back, we are going to observe Daktari here, show us some practical aspects of the kind of work that he does. So stay tuned.
You are watching TV47, the home of untold stories.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
Are you looking for a college that will shape your future career? At Kandy College of Beauty and Applied Sciences, we offer advanced courses with personalized attention to our students. Come and get your diploma or certificate in cosmetology, hairdressing and beauty therapy, diploma in community development and social work, or certification in catering and accommodation operation. We also offer diploma in nutrition and dietetics and many more. All of our graduates have secured employment in the job market, while others have gone into entrepreneurship. What are you waiting for? Join us today. For more information on how you can enroll, visit us at the London Beauty Building, 5th floor, Taveta Road, Nairobi, or call us on 0726 031 109 or 0784 515 606. Facebook, Kandy College of Beauty and Applied Sciences, or on Instagram, Kandy College of Sciences. Our January intake is ongoing. Kandy College of Beauty and Applied Sciences is the cutting edge college.
You are watching TV47, the home of untold stories.
Welcome back again to Body Garage, the art of well-being. We are continuing the conversation on oral health. We've had much to talk about with Dr. Cosmas, but we are at his workstation to see what he does. So, Daktari, karibu tena. And so we can see your beautiful place.
Yeah.
What is this about?
This is a dental chair. Now, this is what we use to treat our clients. When you come, this is how you sit. Then now I'll start by examining. These are light. Then we have now we also have the camera. If a client wants to see how the teeth are, we'll proceed to show her how it is. But first we begin by examining the mouth. Kindly open them out.
So the tools you are using, what are
Yeah, these are probe and these are mirror. These, like the name suggests, a probe. You probe where there is a problem, where there is a decay. Yeah, this one is just a mirror to check. Yeah, so you start by examining the lower teeth. I can see there's a decay down here. The dental caries I was talking about. Now there's a decay both at the surface and at the side, and also there's a decay here. Yeah. Then there's a tartar here, just a little bit. Decay as well. Decay. So at the lower side, the lower jaw, she has 4 teeth that need filling and cleaning, the scaling.
All right.
Then when we go up, the last tooth is decayed. The upper part is better than the lower. Then this side also is decayed, the last one. So upper part there are 2, and then just cleaning.
All right.
Yeah, so maybe we can proceed to show her how they look. Yeah.
All right.
Assist me with the...
So I can see you're wearing gloves. Why is it important?
It's important because now I cannot examine a patient with my bare hand. Yeah.
But we put our hands in the mouth without gloves.
Yeah, your mouth
Yeah.
and your hand. But you have to at least make sure that your hand is clean before you touch it. You cannot be walking around and then put your mouth inside.
All right.
So this is a camera. Now that's the monitor.
So you want to show her?
I want to show her the tooth that is decayed. Yeah.
Because she cannot see them herself.
Yeah,
All
yeah.
right. That's interesting.
Now that's where the decay is. You
Which
can
one?
see the black
This one?
thing. Yeah.
At the center.
Yeah, at the center.
All right.
Yeah.
And this one also.
Then you can see the one at the side.
All right.
Yeah.
This one.
Yeah, that's also a decay. Yeah.
Okay.
Then there's another one here also. Can you see that decay?
This one.
Yeah.
Okay.
Yeah. At the surface as well. Yeah, the black.
Yeah.
Yeah.
Wow.
That's the one I'm talking about.
From your assessment of how serious can this be? Is it
just a
mild form?
feeling? It cannot. It can be done on one sitting. Just
On
a
one
feeling.
sitting,
Yeah,
okay.
just a feeling. Yeah.
All right.
Then we go this other side. Yeah. You can see as well there's a decay there.
This one.
Yeah, the black
Okay.
looks like a cross.
Yeah.
There's another one here. There's also a decay. So when you remove that decay, you get a hole. You know, when you remove, you get a hole. Then now you fill that hole.
So okay.
That's a filling now.
What do you use to fill? It's called
Material called composite.
composite.
Yeah, it binds well with the tooth. So that's the tartar I was talking about.
This
You
one.
can see, yeah. Even between the teeth, you can see the yellow part.
Here, yes.
Yeah. That's the tartar. You can see also there.
The yellowness.
The yellow, the gray part. Can you see along the gum?
Oh, here, down here.
Yeah.
Okay.
It's much clearer now. Yeah, there.
And you
So
say
that's
tartar
the-
comes because of food.
Food, yeah.
particles
You
all
can
the
see
time.
also there. Along the gum.
Along the gums.
The yellowness.
Yeah.
Yeah. So that's what I was talking about, the tartar.
Wow.
So now she needs cleaning and
So you
filling.
finished. Sorry, you finished with your examination
And I've also come up with a treatment plan.
with a treatment plan.
Yeah.
So what is her condition right now? Like what is the diagnosis? What is she ailing?
The diagnosis for that, we call it pulpitis.
Pulpitis.
Pulpitis meaning the inflammation of the pulp. Yeah.
All right.
Yeah.
And then treatment?
With the tata, or the treatment for pulpitis is filling.
Filling.
It is not just pulpitis, it is reversible pulpitis.
Reversible pulpitis.
The one that is irreversible is the one you do root canal.
Yeah.
Yeah.
All right. Wow.
Yeah. So then this one is what we call gingivitis, the one with the gum.
On the gums.
Yeah. So now you do just full mouth scaling and then you polish.
Yeah. Wow.
Yeah.
Now she can go and pay and come and get treatment. All right. So after examining, what do you do?
Now we begin the process. We know the mode of payment. The client is paying with insurance or cash. Then once that is settled, now we begin the process.
Yes.
Yeah.
Okay.
Yeah.
And
as you can see, we have all the insurances. So normally, most of our clients are insurance.
Yeah.
So normally there are those insurance that require pre-authorization before you proceed.
You proceed,
and there
yeah.
are those which just say proceed. So we follow the guidelines.
Yes.
Yeah.
All right.
Yeah.
Sounds good. So she has pulpitis before the insurance approves. Anything she's going to need to use at home as we wait for?
No, it's going to be done the same day. Even if we say pre-authorization, pre-authorization takes like 15, 20 minutes or even 30 with delays. Then we can proceed with the procedure. Yeah.
All right.
The only thing that will be done is now we have to administer local anesthesia, that's an injection, to numb the area.
Yeah.
Then now you can begin the filling. Yeah.
Great.
Yeah.
Wow. I don't know if the patient has a question. Yes. I think, Dr. we really appreciate your time.
Yeah.
Thank you for teaching us so much about oral health. And I believe that our viewers have learned a lot of stuff.
Okay.
And we are going to do our due diligence to take care of our oral health and to seek help as soon as possible.
Yeah.
Yes. So how frequently should we do dental checkups on a normal person?
6 months.
Every 6 months?
Yeah, every 6 months.
It doesn't matter whether you're sick or not?
Yeah, it's good to be seen. Yeah. Also, we recommend scaling after 6 months.
Scaling.
So, yeah, so it's okay. Yeah. And actually, when you say, like in Kenya, if you say, I check maybe if you're 5 in a room, at least 4 have dental issue.
All right.
Or all of them. If not all of them, at least 4.
Yeah.
Yeah.
That's a quite a high number.
Yeah.
The number is quite high. That's really important for us to know. So otherwise, we appreciate your time, Daktari.
Okay.
Maybe as we come to the close of this show, I would like you to talk to our viewers, your parting shots and your advice to them as we come to the end, and where they can find you for more services and education.
What I would say is just like you treasure your body, start with your mouth or your oral health. It is something that introduces you to the world. It is something that identifies you as a person. So I would say treasure your teeth, invest in your teeth, and you can never have these problems. Once you decide to pay attention to them, you'll be okay.
Yes.
Yeah, and we are here located at Utawala. This is a Utawala Komarok branch.
Yes.
We also have another branch in Komarok. You can also find our dentist there. From here, you can always find us. We normally operate as 9 to 6. You can always find us.
Yes.
Yeah. We also work on Saturdays. Yeah.
All right.
Yeah.
Now we have what we need to hear and to help us live a better day, better health. So thank you very much, everybody. If you have watched to this far, we really appreciate, because I believe that we've helped you to understand better about your health. And we've come to the close. Remember to follow us on our social medias, and remember to come back every Thursday from 8 p.m.